Hello friends, I am Dr. Mirajul, Assistant Professor in Medical College, and I am going to teach you today a topic which is a very important topic in terms of clinical biochemistry as well as in the medicine, and that is acid-base disorder. My whole topic will be divided in three parts. Let's start with the acid-base disorder. So there are two processes in the body taking place all the time, which is acid and base formation. So there is a regular reaction taking place in our body, which is carbon dioxide combines with water in presence of carbonic anhydrase, and it makes carbonic acid, and the carbonic acid again gets converted to H plus ion and HCO3 minus, that is bicarbonate. So basically, so acidosis is what? When there is an increase in H plus ion, it's acidosis. And if we decrease the H plus ion, is nothing but alkalosis. So the carbon dioxide is continuously making the carbonic acid. That means if we increase the amount of carbon dioxide, the carbonic acid will increase, and so the H plus ion will increase. So in any disease, if we increase the carbon dioxide, will increase the acidosis. So we know from the Henderson-Hasselbalch equation that pH is equal to pK plus log SCO3 upon CO2. So for our convenience, if we cancel this log and pK, then pH will be equal to SCO3 minus by CO2. And again, CO2 in lungs, we all know that is nothing but a partial carbon dioxide, pressure of the carbon dioxide. So we, from this formula, we can easily tell that SCO3 by partial carbon dioxide is equal to pH, and so the pH is directly proportional to SCO3 bicarbonate, and pH is inversely proportional to partial carbon dioxide. So if we now let's talk about the respiratory acidosis. So let me tell you, if we are talking about the respiration, then we are talking about only the partial carbon dioxide, because the lungs deals with only carbon dioxide. Whereas if we are talking about the metabolic, then the metabolic we are talking about the systemic, and that's we are talking about the kidney, and kidney deals with about the bicarbonate, which we will discuss about later. So now let's talk about the respiratory. So respiratory acidosis is nothing but increase of PCO2 from this formula, which is we have calculated HCO3 by PCO2 and pH is equal. So if we increase this, natural pH will decrease, and once PCO2 increase, pH decrease. So if pH will decrease, we will lead to the acidemia. So acidosis. Okay. So now let's think about only partial carbon dioxide. Partial carbon dioxide, you have to think that when we can increase the partial carbon dioxide, only and when there is a disease of lungs. So the lungs start retaining the carbon dioxide, and or the other thing could be like somehow due to some infection or due to some injury or due to some drug effect, we decrease the breathing rate, that is respiratory rate will decrease. So for example, our respiratory rate is like normal, which is 18 to 22, but if we will start respiration or respiratory rate decreases, like we start respiration like So what happens? The partial carbon dioxide in the lungs will increase and the pH will decrease. So the body will have acidosis or acidemia. Now, how can we increase the partial carbon dioxide? So we can increase only by having some disease or by dysfunction. So disease can be those diseases which retains the carbon dioxide. For example, pneumothorax, hemothorax, COPD, we all know that. So the disease which is pneumothorax, hemothorax, COPD, chronic bronchitis, these are the disease. And the other reason could be the dysfunction of the lungs, that be if we have some intoxication of the drug, so that could be drug intoxication or some injury, brain injury. So these are the reason we will have a respiratory acidosis. So now we have to, one thing you have to understand, that when we will talk about acidosis, that is precisely respiratory acidosis, we will talk only about PCO2. So now one diagnosis has already been made, that is when we will see the reports, that is ABG report. If we look at the pH, and the pH should be, the normal pH we know is what is 7.35 to 7.45 normal pH. So when the pH will be less than 7.35, it's acidosis or acidemia, and conversely it is more than 7.45, it is alkalosis. So if we look at the pH and we find the pH is less than 7.35, we will straight say that it is acidosis. So first of all, I did tell you that we have already concluded we have already understood that how we can say about the acidosis, that if the pH is lesser than 7.35, we will straight say that acidosis. Now let's talk about precisely respiratory acidosis. So we have to look for what? PCO2 in the report, right? And what we will look, whether it is increased or decreased. So if the PCO2 is increased, then you will say that is respiratory acidosis. But for that you must be aware of what is the normal range of PCO2. So the normal range of PCO2 is in between 33 to 44. So, and since is a pressure, so mmHg will be the unit. So for my convenience, I generally take the highest, that is 44. So we will 44, just 40, 44 for the rough idea. We'll check that 40 or 44. So if we will see that the pH is higher than 44, then we will straight away say that it's acidosis and precisely respiratory acidosis. So we will not think about anything else, no metabolic, no HCO3, we will only think about the PCO2 and we'll think that this is the respiratory acidosis. Now we are talking about metabolic acidosis, that is metabolic acidosis. So I have already told you that when the metabolic word comes, we will only look for what? We will look for only HCO3. And PCO2? No. HCO3? Yes. So this formula we know that pH is equal to HCO3 minus upon PCO2. So once metabolic acidosis comes, then what? If this HCO3 will decrease, pH will decrease. and PCO2 we will take it normal. So it's very simple. pH is equal to HCO3. So when there will be decrease in SCO3, there will be a decrease in pH, and that will be a metabolic acidosis. So when we will consider metabolic acidosis, we will only consider what? We will only consider HCO3. If we will consider respiratory acidosis, we will only consider PCO2. So the moment I look the ABG report, I look at the pH first. I look at the pH, it is 7.35. Oh, I got it. It's 7.35 lesser, like 7.25, 7.21. It's acidosis for sure. Then what we have to look? We have to look for the either bicarbonate, or we have to look for the PCO2. If we look at the PCO2 and the PCO2 has been increased than the normal range, then it will be respiratory acidosis. And if we look for the HCO3, if it is decreased, then it will be metabolic acidosis. So HCO3 is metabolic, PCO2 is respiratory, and pH is acidosis. I hope you have understood everything. Now we will be talking about the anion gap, because metabolic acidosis is always associated with the anion gap. So what is anion gap? Anion gap is nothing but it's a gap. It's just a gap. So what is the gap? It's a gap between cations and anions. That's anion gap. It's simple to remember. We don't have to run for the anion gaps. I mean, we don't have to run for the terminology. We have to understand simple way that gap is gap between cations and anions is anion gap. So what? What are the cations? Sodium plus potassium minus Cl plus HCO3. So these are anions, these are cation. So if we look at the anion gap, this will be difference of the cations and anions, and that will be the normal range is 10 to 14. So I consider 12 in general plus minus 2. So in roughly I remember in the higher value, so the 14 and this is 44. Where is that? Okay. So the normal range, the normal range of cation is 10 to 14. So if it is less than 10, that means what? It's a normal anion gap. That's called nagma. It is more than 14. It's called hagma, high anion gap metabolic acidosis. Nagma is normal anion gap metabolic acidosis. Hagma is high anion gap metabolic acidosis. So the metabolic acid has either high anion gap or a normal anion gap. So the normal anion gap, as we discussed, is between 10 to 14 millimole per liter. So if it is higher than 14, it will be hagma, high anion gap metabolic acidosis. It is less than 10, that means it will be normal anion gap metabolic acidosis. So what are the diseases which causes normal anion gap metabolic acidosis, and what are the diseases which causes high anion gap metabolic acidosis? So normal anion gap acidosis consists of, I have made a mnemonics for that, and that is hard as. That is a mnemonic for the nagma, and that is very useful for your Neet PG exams, because this will be asked, and if you remember, not miss the disease. So H for hypercholesterolemia, A for Addison's disease, R for renal tubular acidosis, D for diarrhea, A for the acetylamide, S for spironolactone, diuretics we use it, and that causes the nagma, and S again for the saline infusion. Now let's talk about the hagma. Hagma is The mnemonics for the hagma is mud piles. M for methanol poisoning, U for uremia, D for diabetic ketoacidosis, P for propanylene glycol poisoning, and I for isoniazide, the drug which we use it, lactic acidosis, E for ethylene glycol, and S for the salicylate poisoning, salicylate overdosing, and that will be in the late stage, because the early stage will cause different thing which we will discuss later, but the later stage will cause a hagma. And these things are very important when you appear in the PG NEET exams or for your university MBBS exams. That will be now that all will be case study based examination, and you will be very much able to solve. So far, respiratory acidosis, metabolic acidosis consists of NAGMA and HAGMA. So, and the normal range for calculating these things, so we have to calculate three things. One, first of all, we have to look for the pH, that will be either 7.35 or 7.45. Accordingly, we will tell acidosis or alkalosis. Then we will look for the HCO3, that is bicarbonate, or the PCO2. So if the PCO2 is between higher than 44, that means it will be alkalosis, and that will be acidosis, and that will be respiratory. Again, the SCO3 will be less than 22, that means metabolic, and that will be acidosis. Then we will look for the anion gap. If less than 10, normal anion gap, more than 14, high anion gap. I hope things are clear. Now we are moving towards the alkalosis. We are going to discuss about the alkalosis now. So if we look at the H plus, if the H plus ion decreases, then it will be alkalosis and pH will be increases. So if the pH will be more than 7.45, so normal pH is 7.35 to 7.45. So if the pH will be higher than 7.45, we can clearly, by looking at the ABG report, that it's definitely nothing but alkalosis. Now the things comes either respiratory or metabolic. So again, pH is equal to HCO3 by PCO2, pH constant by PCO2. So I told you that we will not look on the HCO3, we will only look at the carbon dioxide. So if the carbon dioxide, partial carbon dioxide pressure decreases, the pH will be increases, and so alkalosis. Now we have to think for what are those diseases which can cause high elimination of carbon dioxide from our lungs. We have to just look at it. We don't have to remember the diseases. We just have to remember what are the conditions in which we will not be able to retain the carbon dioxide. And that will be what? When we hyperventilate. When we hyperventilate means we start breathing at the higher rate, higher respiratory rate, like that means we are breathing out more carbon dioxide, and the carbon dioxide partial pressure decreases, and so the pH will be increasing, and this is alkalosis. So what are the diseases which can cause a person to hyperventilate? And that will be, it could be high altitude, anxiety, panic syndrome. You just have to consider what are things which will compel you to eliminate the carbon dioxide from your body. Hysterical hyperventilation. So these are the conditions in which you hyperventilate, and definitely once you hyperventilate, you will do what? You will decrease the partial carbon dioxide, and so you increase the pH, and that will be respiratory alkalosis. So now you will look at the pH. pH is more than 7.45. Oh, this is alkalosis. Look for the what? If you look at the ABG report, you look at the pH, that is more than 7.45, that means what? It's alkalosis. Now what you will look for? You will look for the PCO2. The PCO2 is low, lower than 20 mmHg. That means pH is higher, and that is alkalosis, and that is respiratory alkalosis. So we understood that. Let's talk about the alkalosis, and that precisely metabolic alkalosis. So metabolic alkalosis, we know that it's dealing with the kidney, and the kidney deals with the bicarbonate. So we will only consider bicarbonate. We will not consider partial carbon dioxide. So pH is HCO3 minus by constant. So if the bicarbonate increases, the pH will increase. So we have to think that what are the diseases which can retain the bicarbonate in human body, and those diseases I have made mnemonics for that, and that is vomit, that is V for vomiting, O for overcorrection of hypercapnia, M for mineralocorticoids excess, I for infusion of bicarbonate, and T for total volume loss, and that volume loss can be a blood loss, that can be a intestinal fluid loss because of the high amount of laxative use or diuretics. So these will all cause SCO3 or bicarbonate retention in the body. Now let's summarize the lecture. So we look at the report, and we look first what? We look at the pH. If you look at the pH, if it comes less than 7.35, acidosis, more than 7.45, alkalosis, partial carbon dioxide in increase, respiratory acidosis or alkalosis. If bicarbonate is increase or decrease, that is metabolic acidosis or alkalosis. So now I feel that you have understood everything. Now the compensatory mechanism and the ABG will follow in other lectures. So if you like the video, please do like the video and subscribe the video so that you will get the next coming up videos easily. Thank you very much for your attention.